You may have seen the recent headlines about Tylenol and autism. It's a controversial topic, and whenever medicine, politics, and children's health collide, emotions run high. My goal today isn't to stir division. It's to take a deeper look at what this conversation means for our health and why it connects to a much bigger picture. Just recently, major news outlets covered comments linking Tylenol use during pregnancy and early childhood to increased risk of autism and other neurodevelopmental challenges. Some dismissed the idea outright. Others pointed to decades of research showing possible associations. Regardless of where you land on the debate, what matters is understanding the principle behind it. What happens when we routinely suppress the body's natural responses, like fevers and inflammation? In chiropractic and integrative health, we've always emphasized that the body is intelligent. Symptoms like fevers, inflammation, and pain aren't random malfunctions. They're adaptive responses. A fever, for example, is the body's way of mobilizing the immune system to fight infection. When we suppress that process with a drug, we may reduce discomfort in the moment, but we risk interfering with the body's healing mechanisms. This isn't just theory. The literature has shown that aggressive fever suppression can sometimes worsen outcomes and infections. And long-term, the idea that suppressing small problems can contribute to bigger chronic issues is a pattern we see again and again. Tylenol is not the only example. We see this with steroids, antibiotics, and other symptom-suppressing drugs. Relief in the short term often comes at the expense of resilience in the long term. This doesn't mean medication is never appropriate. There are situations where intervention is absolutely necessary, but the principle is this: when the default is suppression, we often miss opportunities to support the body's natural processes. So what does this mean for you, especially as a parent or grandparent? First, recognize that not every symptom needs to be suppressed immediately. Sometimes the best support is rest, hydration, or allowing a mild fever to do its work. Second, if medication is truly needed, use it judiciously. Be aware of both the benefits and the risks. And third, focus on the fundamentals of resilience: nutrition, movement, quality sleep, reducing toxic exposures, and maintaining a nervous system that adapts well, which is where chiropractic shines. The Tylenol and autism debate will continue. The science will evolve, but the principle remains steady. Your body is designed to heal. When we work with it instead of against it, we give ourselves and our children the best chance at long-term health. So the next time you see a headline like this, pause and ask, is this really about the drug in question, or is it about a bigger conversation, one about trusting the wisdom of the body?